People are dying at an alarming rate in Democratic Republic of Congo. The country is in the grip of a deadly Ebola outbreak. In the past 7 months since the disease reoccurred, over 500 people have died. And while treatments have improved, the epicenter of the outbreak is in a region torn apart by conflict. This is severely hampering efforts to fight the disease. Doctors Without Borders has now had to close 2 of its treatment centers, and here's why.
The smoldering debris of an Ebola treatment center attacked by armed assailants. It's one of 2 Médecins Sans Frontières facilities targeted in the Democratic Republic of Congo's North Kivu province. The aid agency has since suspended its medical activities in the region, which is at the epicenter of an Ebola epidemic.
We're still investigating. It was quite well organised. They set fire to areas that were not for treatment, like the changing and utility rooms, which were burned down. But in any case, the treatment centre is no longer operational whatsoever.
The Ebola outbreak is one of the worst in Congo's history. First declared last August, the hemorrhagic fever has killed over 500 people so far and infected over 300 others. Aid workers have faced mistrust in some areas during their efforts to contain the outbreak. It's a concern Congo's health minister is trying to end.
We must not forget that Ebola is a fatal illness, an extremely contagious disease. There are entire families in North Kivu who have been decimated. In the West African epidemic, entire villages have disappeared. So the message is that the teams fighting Ebola are here to ensure the population don't suffer a great loss.
The unidentified assailants behind this incident set off a fire and became embroiled in a gun battle with security forces. Congo's health ministry said 38 suspected Ebola patients and 12 confirmed cases were in the center at the time of the attack. None of the patients or staff accounted for were injured.
For more on this, Jens Pedersen of MSF joins us now. Very good to have you with us. I mean, it is truly a petrifying disease, isn't it? What is the status of it at the moment?
Well, the status in the current outbreak is that for all intents and purposes, it remains out of control. It remains an incredibly complex and, as the pictures have shown, quite a violent environment to work in as well. And this is an outbreak which happens several years after the world's largest outbreak in West Africa, where we had no tools available, whether vaccines, whether treatment. We now have a lot more tools available, but we're seeing that in spite of these tools, we are still struggling to put together a comprehensive response to what is now the second largest outbreak that we've seen of
Why?
Ebola.
Why is it so hard?
Well, there's different reasons to that. As you'll know, the eastern part of DRC is a complex environment with many decades of conflict, many decades of violence. It's the area where elections were postponed earlier this year. It's an area where the population has a general, I would say, mistrust or apprehension against government. All of a sudden, there's a disease which, for all intents and purposes, requires that you take away the patient from the community.
And sorry, very quickly, I believe that the military is doing that, which I should imagine infringes on their rights as well. I should imagine that's not going down too well.
Well, we have seen in this outbreak an increased use of security forces, either to protection, for the sake of protection of facilities, for tracing contacts or people who have known to have been in contact, which of course exacerbates sort of the climate of Ebola being not only a mysterious disease, but also a disease which is sort of very dismissive towards the communities and towards the patients that suffer from it.
What I found quite interesting is how 43% of the patients in the last 3 weeks were still being infected without known links to other cases.
Yes.
Why is that happening?
The why is a good question. I mean, it tells us that the component of surveillance, of tracing known contacts of patients is inadequate, because ideally you would know which patients had been in, or which people had been in contact with a known case, and thus you would be more likely to know who is at risk of developing the disease. However, in this environment, because of a general lack of solid trust-based interaction with the communities, we still see, on top of all of the numbers not being known on our contact list, we still see that 40%, Jane, of the patients die in the communities instead of having been traced and admitted to an Ebola treatment facilities. Okay. So we're clearly seeing a disconnect.
And what is the time frame now if somebody contracts this? Where does it leave them? How quickly do they have to get attention? And what are you looking at as far as DRC is concerned if you don't resolve this now?
Well, so the so-called incubation period from when you've been exposed can depend from anything to 24 hours up to a week or 10 days. What we're looking at MSF is, as you know, as I mentioned, we've suspended our activities in some of the affected areas, in Katwa and Butembo. We're still active in other areas. But we clearly need to see a fundamental change in the entirety of the response, an entirety which is based much more on trust with the affected communities and engagement with the patients infected with Ebola.
Okay, thank you very much for talking to us. I really admire the work that you do, how MSF is on the front line fighting these battles. Thank you.